EMS professionals feel undervalued, and often they are undervalued within the healthcare system. And you'll hear me say it over and over on behalf of NAMIHP, and just my personal perspective as well, that we do see that EMS professionals are widely undervalued and under-recognized.
Many EMS professionals often feel undervalued within the healthcare system. What factors contribute to this feeling, and how prevalent do you believe that this really is?
Oh my gosh, Dan, you're starting right out of the gate with value. I would leave it to you to hit us with a really incredible topic right out of the gate. I think that when we talk about value, we think about value in healthcare and the value that we're making in outcomes. But the point and the question being asked here is about how EMS professionals feel undervalued. And often they are undervalued within the healthcare system. And you'll hear me say it over and over on behalf of NAMIHP, and just my personal perspective as well, that we do see that EMS professionals are widely undervalued and under-recognized. And, really, mobile integrated health is incredible here, because what mobile integrated health allows for EMS professionals is the ability to demonstrate their collaborative nature, but also the immense variety of skills that come with their experience and their work in the EMS realm. And, there is nobody else on the healthcare team that is better positioned for triaging in an adaptable or unscripted environment, so to speak. And in our struggling aspect of healthcare, where we have so many people that are falling through the cracks, who else to pick them up out of that crack better than EMS professionals? So, when we talk about being undervalued across healthcare and how MIH impacts that, that's what you're going to see, is that MIH allows for that quality of care to be improved, those patients who really need access to be reached. And there's money to be made here for the rest of healthcare once we figure out really that there's this huge resource that we've not been able to capitalize on. So, money talks, but really focusing in on the impact. There's money to be made, but even more impact to be made, which is really exciting.
No, that's a great answer. It is widespread, so it covers a large area. If you look at it, how can EMS professionals implement MAH programs, and particularly what skills and training would you feel are necessary for them to really thrive in that space?
Oh gosh. So we think about skills, from a concrete perspective, or, a physical clinical skill in an intervention that we would perform with a patient. But the skills in MIH, boy, it's going to challenge you. I think that one of the biggest is building relationships, as you and I know and have gotten to benefit from throughout our work together here in MIH. But, building relationships locally, at a state level, nationally, important for every single person on the MIH team for sure. And then, if you are thinking along the lines of the clinical skills and the interventions, things like motivational interviewing and understanding chronic diseases, very important as well. So, innately, I would say that I've identified maybe a core factor of being successful in MIH and community paramedicine is bravery, because we have people across this industry that are stepping out of their comfort zone every single day to learn how to communicate more effectively, to build new relationships, to improve their clinical skills with new patient populations. And that takes some bravery from every person that's involved with MIH and CP.
Yeah, and bravery is a key word there, because I think just to join in EMS in general, it's one of those attributes that people have. So
absolutely.
To see it leveraged. What are the benefits that mobile integrated health adoption bring to EMS professionals and the communities that they serve?
How many can I list? How long do we have here?
We'll cut to you're good. However you like.
I know. Well, the very first question that you asked today, Dan, was about value and how do we course correct or improve the fact that EMS professionals are undervalued across healthcare. And maybe that's also the answer here, is that, mobile integrated health allows for EMS providers to be able to demonstrate that. And that's important for everybody. But I know that across EMS and in fire, we know that burnout is a challenge. We know that retention is a challenge. We know that reimbursement is a challenge. And I will say that we don't see the same burnout and retention issues in mobile integrated health as we do historically across EMS. And the reason for that is just anecdotally, we have teams constantly that are starting to feel that instead of being a broken part of this healthcare system where they're coming and responding to, a patient, Mrs. Smith, to pick her up 4 or 5 times this week, that they're starting to now really be part of a longer term, bigger picture healthcare solution. And they're getting to develop new skills. They're finding an entire new aspect of self-motivation and self-fulfillment of being, a different part of healthcare, so to speak, and really being focused on how do I improve this so that it doesn't happen again. And if you're a leader in EMS, if you're a leader in any profession or any industry everywhere, if you have the opportunity to, reduce burnout, improve the motivation and engagement of your team, and to help them, tap into a purpose every single day that is fulfilling to them, I literally cannot imagine a better case scenario for a leader. So, I think that there's 100 different reasons why it's beneficial to EMS, but certainly the workforce development and engagement of our teams is one of them.
No, that's a great answer. And I think that core desire to help, right? At the end of the day, this is a new aspect of being able to help. So that's a tremendous answer.
Absolutely.
So the MIH Summit coming up soon. It's bringing together the providers, the groups, the payers, the mobile integrated health groups, the community paramedicine teams, and other advocates that are all working to reshape healthcare. What are some of the key topics and themes that you'll be looking at or be really looking forward to? And then what is the most important aspect that you'll be looking forward to seeing there?
So, the number one question that you get asked in the realm of MIH and CP is how do we get paid for this work? How do we improve, revenue and sustainability opportunities? And so a big focus of the summit coming up September 9th and 10th, but everybody's going to come in on the 8th, right, to join us for the networking event. So the big focus there, of course, is revenue and sustainability. And we're integrating or kind of threading through the different national priorities that we're seeing in rural health and health equity, really excited to just be front and center with the topics and questions that the industry has. And over 50 speakers that are coming to share their knowledge and expertise. So please do join us.
Yeah, and the summits are fantastic, and the amount of questions and the unknown is really what, is most impressive, right? Because there are so many people seeking so many answers to so many questions. So it is a great place for that.
Yeah.
It was really great chatting with you, Victoria. Mobile integrated health models are revolutionizing the EMS industry, helping to make healthcare more accessible and efficient than ever before. Thanks again for joining us on Schein Chats, and we'll see you next time.